Hi, I'm Dr. Mark Scott with Genesis Foot and Ankle. The first question I think we need to answer is what are bunions and what causes them? Generally, people come into the office and say, I have a bunion. They may or may not because people misunderstand what a bunion is. A bunion is actually not a growth in the side of the foot. It's more of an actual bone moving in the inside of the foot. It's causing the big toe to displace and causing the big toe bone to move to the inside. People come in with irritation on the inside of the foot. So that's the most common thing we talk about when we talk about bunions. There are multiple treatment options for bunions. Generally, though, it boils down to a surgical intervention. Most people, when they reach my office or reach an office where they do bunion surgery, it's a surgical intervention. We can treat it sometimes with proper shoe gear and insert therapy on younger people, but even younger people require surgery. So more often than not, when people come into the office and they have a bunion, they have a painful enough bunion that they say, we need to have some surgical intervention. People in general, the question is, how do I know when it's time to have bunion surgery? Bunion surgery really boils down to if it hurts and it's limiting your daily activities and it's interfering with your health and the things that you want to do, it's time to move forward with some type of bunion surgery. The reason that we're here today is I'd like to discuss minimal incision bunion surgery. It's a new surgical intervention that we're utilizing over the last 5 or 6 years, and what we have found is that it improves function, you can return to your activity levels faster, and it is much improved with regards to overall pain management. Previous bunion surgeries have been fraught with significant pain, significant downtime. We have found with this new bunion surgery, there's limited anesthesia, limited incisions, and very limited pain, where we used to have to provide significant pain medication post-operatively for bunion, and it prevented people from having bunion surgery because they knew somebody that had had bunion surgery in the past, and I'm never going to have bunion surgery because it hurts too much. Now I've had people who have had bunion surgery and actually taken Tylenol rather than any narcotic post-operatively. In this day and age, I think that's important to be able to limit the amount of pain, but also to be able to return these folks to the level of activity. And cosmetically, I've found it's much better than previous surgical interventions. When we find a procedure, and I'm not one to jump on every procedure that comes out. I usually let other people work through the complications, work through the problems, and then ascertain whether it's something that I want to perform or not. But I finally have found a procedure that I think is really beneficial, and we can return people to activity levels very soon. When we look at candidates for minimally invasive surgery, and fortunately at this point, most everybody can have minimally invasive surgery. There were a multitude of surgical procedures with regards to bunions in the past that you had to pick from a plethora of surgical interventions based on age and bone quality and activity level and actually the degree of the bunion and how bad it was. We've been able to reduce that profile and decide who we want to do the surgery on, who we don't want to do the surgery on, just down to one procedure. I have found, and since I'm really the only one currently in the area at Genesis that is doing the procedure, I kind of brought the procedure here. In the evaluation, the people come to my office, and for the most part, we'll offer 99% of the population the opportunity to go under or go through with the minimally invasive procedure, as opposed to, some of the other procedures that require a lot more.